Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast. We're going to talk about the sinus and bronchitis, asthma, and the people getting affected with common cold very often, sneezing and so on. So these are all one and the same. This is to do with our nasal sinusitis areas and, the air tube and the lung. So all these problems, are very common these days. It's called Neerkovai Ovamai in the traditional science in Tamil. So this is one, which is a very highly disturbing problem. There are people who go on sneezing when you get up in the morning. Then it can, you become very tired. So this is to do with a lot of coughing also. So basically when the lung is irritated, the cough becomes the symptom. So now sinusitis, common cold very often, bronchitis, asthma, these wheezing problems, and connected to it the cough, and then the headache connected to it also is there. So what one should do for all these things. Now you remember one thing, any sugary product, when you get into common cold or when you get into all these kind of asthma and all that, just stay away from sugar. Maybe you can have 1 or 2 cups of coffee or tea in a day with little bit of sugar. If you're, it's very difficult for you to stay away from sugar. If you can stay away from sugar, so what am I supposed to do? Don't drink milk, which has got a lot of lactose, and sugar related product, jaggery related product, palm jaggery, ice creams, all kinds of variated water, juice, fruits. Every sweetener should be kept aside, because any sugar molecule, that is glucose, fructose or galactose, these are the 3 basic building blocks. They increase the inflammatory part of your complete nasal and the lung system. If you can stay away from sugar related products for a period of 6 months, there are basically some medicines are there. Remember one thing, medicines can only give you relief. It can sort out your problem, but for you not to get the same problem again, not to, the recurrence should not happen, for which you need to do your food restrictions, especially the sugary products. You stay away from it. And then exercise. Youngsters can go and play, I was a severe bronchitis patient between the age of 13, 14 to 18. Then when I started doing my exercise, my skipping and all that, within 1.5, 2 years, it vanished. In the last 45 years, I don't suffer from it at all. I was a severe asthmatic patient. Games. If you're a footballer, you will never get asthma. If you are, all kind of, respirometer, you remember respirometer. So in my exercising video also I've shown, there'll be a 3-cylinder, there'll be 3 balls, there's a tube, which you suck and lift the balls. If you can practice this, which is one of the highest exercise for the lung, if you can practice this, slowly, build up 200 times in the morning, 200 times in the evening. If you can come to that level and continuously do it, you can make your lung and the air pipe very strong, keep it away from inflammatory part of it. Once you are normal, try to have bare minimum sugary products. Don't go for too many sugary products. Try to avoid fruits, which is not going to help you in this case. And we give you 2 sets of medicines for it. When you are suffering, it can get you out of it. For it not to come back again, you are supposed to stay away from sugary products. And if you are young enough, within the age of 25, 30, 35, you can play some games 1 or 2 hours a day, where you can, tiringly play some game and exercise. And at that time, your lung gets completely exercised. Otherwise, if you are old enough, 40, 45, 50 plus and all that, you can sit in a place and do respirometer and rebuild your lung, the strength of your lung, which can, permanently keep you away this problem. Exercise, food restrictions on the sugary side is the most important stuff. This one, medicine is just 2 sets can be taken or 4 sets can be taken. More than that, I myself won't give you. You can, recorrect yourself with your food restrictions and exercise and respirometer. Thank you very much and good luck. Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.